On Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm Shay Paul, and I am being joined by Dr. Jared Chapman of Living Well. Dr. Chapman, it's always so wonderful having you with us.
It's always a pleasure to be here with you.
And this is very exciting. We're doing something a little different today. We are going to start a four-part series. Basically, we're going to be telling the experience, the journey of a patient of Living Well. We're going to start today with the first part of the experience, which is basically kind of an evaluation, correct?
Correct. The consult.
The consultation, right. So, and this is Heather Ellis.
Correct.
All right, Heather, it's great to have you with us. And so let's get started.
So, we came up with this idea to kind of journey a patient through the practice because as we speak to a lot of clients and patients that come in, their thoughts are, I didn't know you did this, or I didn't know how this would go, or I didn't know that could be done for me in a simple injection. So we wanted to share with the public, what the experience is when you come to Living Well for the first time and you have concerns. Then we sat down with you. So prior to coming on the air, we did spend some time with Heather just to bring this down into a little bit more concise period of time so that we could talk about the aesthetic consult.
Okay.
The first thing I ask the patient when they come in is, what do you like about your face? This is the number one question I want to ask. Everyone brings their list of what they don't like. That's the set down. I don't like this. I don't like that. I want this fixed. But what I want to hear is, what do you like? And when we spoke to Heather, there was some very positive features that Heather has.
She's beautiful.
She is absolutely beautiful. She has natural beauty. One of the features that she really talked about was the eyes. She's very thankful for her eyes. She loves her eyes. She's been doing Botox with us for a while, and she loves the lift that the Botox gives around her eyes when she does, get the treatment. Okay. The other thing she's, really talked to me about was how much she loved her cheeks. And when I asked Heather to do this, that not necessarily was one of the things that she saw any issues with, but as we began to talk about the positive framing of the eyes, we talked about the loss of volume that was occurring just slightly underneath her eyes and in the cheek area. And Heather is in her 40s at this point in her life, and that's usually when we start to see this show up, is the fat pads underneath the eyes begin to dissipate, and we start to see the cheeks begin to drop, and then the nasolabial folds become more prominent, and those are those lines right through here. We call them the laugh lines. And then the other area that starts to show signs of aging from that is around the mouth. And then those are called the marionette
lines, right?
Which we talked about on the air before. So in our consult, we really focused on restoring some volume in the mid-face. And as we progress through this series, the viewers are going to be able to see what just a few simple injections can really do to just kind of reset and refresh the appearance of the mid-face. Okay. It's the number one area we lose volume as we begin to age initially, and therefore, if we keep up with that, then we don't get those severe deficits that we can sometimes see when we hit late 50s and early 60s. Right. So it's a lot easier to prevent something than it is to completely fix it.
So you need to be proactive, right?
Yes, proactive. And then the other thing is we want to maintain the authenticity of the patient. We don't want our patients to ever look artificial. And so the less we have to do, then the easier it is to maintain that. When I see someone, later on in life who has some severe volume loss, that's going to be an obvious correction if I fix that. And it's not that it's not going to look natural. It's just that someone else is probably going to notice if you come in with severe deficits and then I fix them. Whereas someone who comes in early on, we can really slow that down, and then that deficit never shows up.
It's more of a gradual.
Correct. And then the other thing we talked about was around the mouth, the lip lines and the lips themselves. And as we get into our 40s and into our 50s, the natural aging process causes the lip to shrink in size. And so we lose volume because we're obviously losing hyaluronic acid from the skin. And therefore, the lips become less plump and they also become thinner. And she and I were just talking about some asymmetry that she had noticed. And I explained to Heather that asymmetry is a normal part of the face.
Right. No one is perfectly symmetrical, right?
Correct. And in the line that divides the middle of the face, we always say that the face is sisters, not twins. That's what
That's a good analogy. I like
to
that.
point out that there are asymmetries, but an easy tweak of a little bit of filler here or there, or a little bit of Botox here or there, can bring symmetry to the face. And that is, of course, one of the things that's aesthetically pleasing to the eye. The eye will always search for symmetry in the structures that it's looking at. So she and I have talked about this, and we've come up with a plan. And over the next few weeks, we're going to be sharing that plan with the viewers as we lay forth the treatments. These treatments can be done all at one time, or they can be set out over the next, a patient comes in, they can actually set this up over the next year if they wanted to, and not have everything done at once. So it's just a journey through the process, and, even talking about skincare, which takes care of what I always call the wrapping paper of the package. So those are the things we will be focusing on over the next few weeks.
Right. So that gives us something to look forward to. Dr. Chapman and Heather, thank you so much for being with us today. Look forward to seeing you next week and continuing the journey.
Thank you.